Assalamu alaikum. My name is Fariha Shamim, and it's a pleasure to be here representing the Department of Physiology at the University of Karachi with a specialization in hematology. I have recently completed my Master's of Science degree, and I'm here to share the findings of my master's thesis entitled Evaluating the Impact of Heparin and Carica papaya leaf extract on platelets in rats. Now, come to the introductory part. First of all, I'm talking about the platelets. Platelets are the type of blood cells. They are tiny in size and can be crucial for maintaining homeostasis. They can originate from megakaryocytes. Megakaryocytes are the precursor cells derived from the hematopoietic stem cells in the bone marrow. They are produced primarily by the liver, kidney, spleen, and bone marrow. Now I'm talking about heparin. Heparin is a widely used anticoagulant used to inhibit blood clots, and it is used in different medical conditions like in bypass surgeries, open heart surgeries, in kidney transplant, or in blood transfusion. Some patients who receive heparin therapy arises some severe complications called heparin-induced thrombocytopenia. It is basically an immune response against heparin. This can lead to platelet destruction and blood clot formation. Some researchers showed that interleukin-6 and TGF-beta is responsible for the HIT because interleukin-6 is responsible for the production of antibodies, and also it helps to generate some immune responses. And TGF-beta may be responsible for the destruction of platelets or the apoptosis of platelets. Now come to the pathophysiology of HIT. Basically, HIT is divided into two types, type 1 and type 2. Type 1 is not complicated as type 2, and it occurs as earlier as day 1 after the induction of heparin. Basically, this diagram shows that the mechanism of HIT type 2. HIT type 2 is more complicated because it is an immune-mediated reaction. So this diagram shows that when heparin is introduced to the body, it was combined with the platelet factor 4. Platelet factor 4 is a small chemokine, also called chemokine ligand 4, which is released from the platelets and can be responsible for the blood coagulation or promote blood coagulation. After the binding of platelet factor 4 and heparin, it forms complex called PF4 heparin complex. And after the formation of complex, also some antibodies can be formed or produced from the B cells, which this antibodies mainly are immunoglobulin G antibodies. And after the formation of complex, these antibodies attach to the complex and combine with the platelet surface. And after the combining on the platelet surface, they can activate the platelets, and more activation of platelets form aggregation of platelets, or platelets can stick together and form clots at the surface of blood vessel, or they can block the arteries or vessels also. Not only that, also splenic macrophages destroy the platelets, which cause thrombocytopenia in. So now for the treatment of HIT, I'm using the Carica papaya leaf extract because Carica papaya leaf extract can be using or as ancient remedy for the dengue fever, because it contains some compounds, some bioactive compounds called flavonoid, papain, and phenolic acid, which enhance the platelet production by boosting the thrombopoietin hormone in the body, which can enhance the platelet production in the body. Also, these bioactive compounds act as anti-inflammatory, or it has some anti-inflammatory properties, which can suppress the inflammatory markers like TGF-beta, and it may be effective for the treatment of HIT. Now come to the mechanism of action. Basically, when CPLE is administered in the body, they are stimulate the alloxetine CD110 receptor on the liver, and also it stimulates interleukin-6 at hepatocytes. These all are stimulate bone marrow production or bone marrow stimulation. Then after the stimulation of bone marrow, thrombopoietin production enhances from the bone marrow, and this thrombopoietin increase the megakaryocytes production, which are the precursors of platelets, and after that platelet count also increase in the body. Now, the research objective. My primary objective is to induce or cause heparin-induced thrombocytopenia and its treatment with CPLE. And my second objective is to investigate the effect of heparin and CPLE on hematological parameters, on weight and glucose, on histological alteration, and also I am I'm trying to find out the association of genetic markers with these treatments also. Now the experimental design, 18 female rats were used in this study, weighing 170 to 200 grams, and it can be divided into 4 groups. Uh, Group 1 is a control group. Group 2 is a heparin group, in which heparin can be administered from the intravenously through the veins of the tail, and 0.1 ml per 100 gram was administered to the rats, and the dose was taken from the previous study. In group 3, carica papaya leaf extract was given around 400 mg orally, and this dose was also taken from the previous study. In group 4, combined heparin plus carica papaya leaf extract was given. The study duration was 1 week, and standard diet was given throughout. Now come to the methodology. First of all, I'm preparing the carica papaya leaf extract and dilute it into the distilled water. Then orally administered CPLE by the help of oral gavage. Then heparin was estimated through injections from the tail and through the tail, and intravenously it was given. Then after the completion of study, uh, some test was performed. Before these tests, we are estimated the weight as well as glucose. And after that estimation, we are performing bleeding time and clotting time. Bleeding time and clotting time was performed after administering anesthesia. And after that, stopwatch was initiated, and sharp scalpel was used to create a deep cut on the tail. Approx 4 centimeter cut on the tail are created. And after that, the stopwatch was initiated, and also blood was allowed to soak into a paper without applying pressure on the tail. Also, a drop of blood was placed on a glass slide to estimate the clotting time. And after that, a dissection was done, and organs were harvested and kept in a 10% formalin buffer. And also, blood was taken in the EDTA tube for sampling and for the estimation of complete blood count. And also, RT-PCR was done for finding the expression of genetic markers. Now, graph pad used for the statistical analysis, and a post hoc test was used for comparing the group difference. Now come to the results. Effect of heparin CPH on weight and glucose. The bar graph of weight shows that the weight of in all experimental group was decreased as compared to control, while the glucose level in group 2 was increased as compared to control, or as well as in group 4, while in the group 3, glucose level was decreased as compared to control. Now the effect of heparin and CPLE on bleeding and clotting time. So it was showed that the bleeding and clotting time in all experimental groups increases as compared to the control group. Now, the effect of heparin CPLE on CBC. So this bar graph shows that the hemoglobin and RBCs, red blood cells, were decreases in all experimental groups as compared to control, and these results are statistically significant. And fat cell volume was also decreases, but the MCV remains normal as compared to control, and also MCH and MCHC also remains normal as compared to control, but these values are not statistically significant. Now, blood cells also decreases in all experimental groups as compared to the control, while platelets remains normal in group 2 and 3, but slightly increase in group 4 was observed, and these values are not statistically significant. Now, the effect of heparin CPLE on genetic expressions on interleukin 6. It was showed that the upregulation of interleukin 6 was observed in group 2 and 4, and group 3 shows down regulation of interleukin 6. Now, the effect on thrombopoietin, it is mentioned or it is showed that the upregulation of thrombopoietin was observed in group 4, while in group 2 and 3, the value remains normal as compared to control. Now, the effect on TGF beta, it was showed that in group 2 and 4, in group 2, upregulation of TGF beta was observed, while in group 3 and 4, slightly upregulation of TGF was observed. Now, the effect of heparin and CPLE on organ histology. So it was in the study, the control group exhibited normal histology of liver, spleen, and lungs, characterized by normal color, texture, and microscopic cellular features, while in group 2 and 4 exhibited normal results. In spleen, mild splenomegaly was observed, and liver fatty changes were observed along with the enlargement of endothelial cells, while in the lungs, signs of inflammations were evident along with the hyperplastic changes in alveolar cells. While in group 3, where only CPLE was administered, displayed normal spleen, liver, and lung histology. So it's time to conclude the study. It is concluded that heparin and CPLE in rats affect multiple parameters. However, 0.1 ml dose of heparin may not cause HIT in rats. It is suggested that CPLE administered may not fully reduce the adverse effect or might be less effective as the treatment of HIT. Further studies are needed to determine the optimum dose for its efficacy. Now, acknowledgement. I am really thankful to my supervisor, Hafiz Mohammed Usman, my co-supervisor, Dr. Umair Muhyiddin, and Hadia Tausif. A special thanks to her for her assistance in my study. Thank you so much.